minutes walk of the circle for the sampling to enable a very quick nucleic acid test. We have this regular basis for the nucleic acid test, especially for the people working in key areas and regions. We have to make sure that they could be tested in a very timely manner. We also have this tiered mechanism of treatment and also consultation. We have the point of the transfer of the cases for the designated hospitals, makeshift hospitals, and also designated sites of the quarantine. They are all ready so that we can respond to the emergency and also some urgent needs. We have to try to minimize the negative impact on people's livelihoods with our containment measures. We should not apply one single measure against all. We also have to show more care to the elderly population. We have to make sure that these elderly persons can also be all vaccinated. The topic of today's press conference is racing against the clock to continue with our containment measures against COVID-19. We have invited Deputy DG of the NHC Disease Control Bureau Level 1 Counselor Mr. Lei Zhenglong, Inspector of the NHC Medical Management Administration Madam Guo Yanhong, Deputy DG of the Sanitary Quarantine Department of the General Administration of Customs Li Zhengliang, Deputy DG of the Border Control Department of the National Immigration Administration Liu Haitao, Deputy DG of Aviation Standards Department of the CAAC Kong Fanwei. They will all take your questions. Now the floor is open for your questions. Please first identify yourself. The first question, please. Thank you. With People's Daily. Last time during the press conference, you have talked about for the total situation against the COVID-19, we have registered a decreasing number of the local cases. What's your evaluation of the current status quo? To Mr. Lei Zhenglong, thank you very much for this question. Recently, throughout the country, we have noticed that we have stabilized the situation and we have registered fewer new cases every day. On a daily basis, newly added cases is under 2,000. And also regions infected become smaller. In Shanghai, the situation has been improved. Newly added cases have been reduced in terms of the number on a daily basis for 8 days in a row. But still, we are facing a huge challenge in terms of the domestic rebound. For example, there are rebound cases in a lot of key sites, so we still have to consolidate the results. In Beijing, the clusters of diseases as well as the sporadic cases are still in a continuous manner, and many regions are still facing the risks. Currently, in the country, we are facing a reduced risk of the continuous spread of the virus. And for Tianjin municipality, as well as the other regions and provinces like Jilin, they have to continue with their tests. For Jiangxi, Liaoning, and some others, they have already successfully controlled the situation. They have stabilized this situation. In general, in our country, we are facing a huge task. For the NHC, we will continue to give guidance to all the regions so that we can apply the well-targeted measures in our containment measures. We will continue to improve the mechanism of the work, and on a regular basis, we can strengthen our early discovery capacity and also the early classification and treatment. We will continue with the vaccination, so in the shortest delay, with the shortest cost, we can control the emergencies and outbreak. Thank you very much. Next question, please.
Thank
you. With the Fengmian News. The treatment of the serious cases, they are one of the key targets in our treatment system. So currently, since we have already improved the situation in the country, what's our current effort to treat this group of serious cases? What kind of measures have we applied to improve the health status of those cases? To Madam Guo Yanhong, please. Thank you very much for your question. As we know that for the Omicron variant, it's more infectious, it can be spread in a faster speed, and also for a certain proportion of the infected cases, they don't deliver any symptoms. So we can say the variant is spreading in a very hidden way. In a short period of time, the number of the infected cases would have a spike in a very short period of time. With this spike of the number of the cases, some elderly persons and also people with preconditions, after being infected, they can easily go into a serious stage, and this means also a huge challenge for our medical system. For the treatment of the cases, we always put people in the first place and we give priority to life. For all the patients, we have to take all that should be taken into the hospital, into this medical treatment system. We have to guarantee everyone can be treated. At the same time, we have to avoid further spreading of the virus from those confirmed cases to their neighbors and family members. First of all, we have to consolidate the development of designated hospitals. For the serious cases, even for the general cases, we have to cover all of them. So the development of the designated hospitals is the key for all regions and places. When they fix the list of the designated hospitals, they should choose those capable ones with a very high level of management and a very good capacity of treatment. At the same time, we have to consider the status quo. With some of the serious cases, they have not only the virus, but also the preconditions, the chronic diseases. So we urge those designated hospitals to increase their resources for the ICU department, so that for the elderly persons and also people with preconditions, once they are infected with COVID-19, we can immediately put them into the department of ICU. At the same time, we have to equip the hospital with necessary medics, resources, and equipment. Especially for the medics, we have to train them to make them more capable so that they can be more able to treat those serious cases. And next is to standardize the treatment. We have already elaborated the 9th version of our treatment guidebook. So that book is elaborated according to our past experience and practices. We have found a lot of evidence and proofs so that we can finally write this guidebook, the new version. And also we have included the new drugs and medicines developed in the past period. And now for the hospitals to treat the patients, they have to follow the latest version, the number 9 version. And we also have to take our measures and make the treatment in an earlier manner, especially for those people with chronic disease and preconditions. We have to take measures immediately, be more prompt in the treatment and combine the Western medicine and traditional Chinese medicine. During the treatment, we have to treat not only the COVID-19 symptoms, but also their preconditions, the chronic diseases. So that is a multidisciplinary treatment. At the same time, we have to come up with the nutritious support and also the mental, psychological support. So we have to give well-targeted version of treatment to each individual of the patient. At local levels, all of above-mentioned measures have been applied, and we have also yielded fruitful results. For example, this time during the outbreak of Beijing, in total, we have discovered 2 serious cases. So with our careful treatment, all those 2 cases have developed into the mild cases or a general case. And to notice one fact, our country is a populous country. We also are a country with the most the greatest number of the elderly population. And in our country, if you look at the distribution of the medical resources is really uneven across the regions and provinces. So for the prevention and control of COVID-19, we have to be based on this principle of prevention. Prevention should be the first move. For example, the early discovery of the cases with the nucleic acid test, and then we have to define and quarantine the close contacts. So during that early stage, we have to be very quick and really practical so that we can avoid a massive spreading of the virus in a short period of time. And also we can avoid a huge number of serious cases or mortality. So that's why I put the focus here in the prevention stage. And during this stage, for the individuals, they also have to shoulder their own responsibilities. For example, in the containment period, individuals are asked to wear their masks, to ensure regular ventilation, to wash their hands regularly, and also to keep the social distancing. Those are very effective measures to protect the individuals, especially for elderly persons with preconditions. They should give more attention to the self-protection, and vaccination remains one very effective measure to fight against the serious case, and I so encourage everyone to get vaccinated so we can avoid the possibility of development into the serious or critical stage of the disease, and we can also avoid unnecessary loss of the life and treasure of our country and of our people. Thank you. With Phoenix Media, COVID-19 has created a lot of troubles for the people who would like to travel around the world. And after the outbreak of the pandemic, the National Immigration Administration has published a lot of notices to warn people to abandon unnecessary movement. So what's the definition of this unnecessary movement? Now to Mr. Liu Haitao, thank you very much for your question. Currently, the pandemic is still going on across the world. The virus is changing all the time. There are a lot of variants, and we're facing the rising risk of the imported cases. International travel will still bring us a lot of problems and risks. For the short duration of the international trips, there are entries and exits. For people who make short-term trips abroad, they will bring more risks to the country and also may bring possible loss to the individuals and families. So the groups of visitors to foreign countries are still suspended. We don't encourage people in our country to go abroad to visit their family members and friends abroad. For people who have this plan, please consider this high risk related to international travels. And remember that there's always the uncertainty. If not necessary, if you don't have some emergencies, please don't go abroad for the visits. That's the best way to protect your life. I hope that we can all work together to consolidate the results. Hard won. According to the work arrangement of our administration, all the authorities at different levels will continue to work hard and guarantee the operation of enterprises, Chinese ones or foreign ones. We will also try to satisfy their rational needs for the resumption of the work. For the medical teams that do have the need to go across the border to save lives in foreign countries, and also for the importation and exportation of the materials, as well as for the labor dispatch, employment, business, scientific research, overseas studies, examination, and scholar exchanges, medical visits for people in a critical situation, and to deal with the funerals and to take care of the infants, elderly people, to participate in the graduation ceremonies, the commencement ceremonies, and other emergent needs. Our National Immigration Administration will first receive and then approve your application. And for those people who do have an urgent need, we will give you an obstacle-free track, fast-track service. At the same time, we will continue to give you the notices about the risks, strengthen our management and regulation for people applying for the visit approval to the regions that have a greater risk related to wars, conflicts. We will persuade them to suspend their trip or to postpone their trip. For people visiting foreign countries, but related to the telecommunication fraud and other cross-border crimes, we will immediately work with other authorities to crack them down. We will try our best to maintain a sound order of the visits of the people across the border. We will continue to work under the requirements of the top authority to fight against domestic rebound and imported cases. We will also evaluate the current state of the COVID-19 spread in the whole world and gradually modify our version of regulation. If you have any questions, you can also use our hotline 12367. You can also come to the service window, or you can consult our website so that you can have a better knowledge about the existing policies and you can have the access to the latest version of the information available.
谢谢主持人，中央广播电视总台财经节目中心记者提问。
Thank you.
目前新冠变异毒株的
And with the CCTV financial news, currently a variant of COVID-19 is becoming more infectious once there are more variants are into the country. We may be facing a much bigger risk. What's the measures applied by the customs to fight against this trend? To Mr. Li Zhenliang, thank you very much. Currently, the pandemic is still raging across the world, and there are new variants from the virus. According to the requirements of the Joint Prevention and Control Mechanism of the State Council, we have worked according to the principle of the dynamic zeroing. We have adopted very strict measures. We have worked according to the requirements of the science and the technologies. In details, first of all, we apply the stricter measures for the quarantine and the checks of the goods and the people. For example, for the people, we will check their certificate of health and also their body temperatures. For the aircrafts and also the ships, we will also do the sanitary checks and also the terminal disinfection. For the ports and also the other terminals, we encourage the localities to use new models for the transfer and delivery of the goods. For the drivers of those vehicles as well as the other pilots, we also strengthen our management of the supervision. Today, we have also the collaboration mechanism for the delivery of information and also for the transfer of the cases. And second, for the variants, we have this system of tests and also the monitoring. We have kept a close eye on the variants, especially for the original places of those variants. For those countries that have recognized the recent fast spreading of the new variants, we will also strengthen our regulations about the goods coming from those countries. At the same time, we are also doing the whole genome sequencing of the new variants. And third, we are fighting against the various different diseases. For the customs, we are working as a very capable network of fight against diseases. Recently, for the hepatitis, yellow fever, as well as the other diseases raging across the world, we have organized an expert team to do the evaluation. We have also published the notices. For all the ports and different local levels of the customs, we have already shared information within. In total, we would like to fight against the extra risks. And finally, we have to make sure that our workers at the front line, they are guaranteed. They are staying in a very safe condition. According to the work requirements given by the top authorities, we have this whole process monitoring of the risks. For people who have the close contact or direct contact with them, inbound visitors and also inbound goods, we will keep a close eye on them and test them on a regular basis. For people working on the front line, we will also guarantee that they are all vaccinated. Moving forward, we will continue to closely follow the development of the virus and according to the work arrangement of China's Joint Prevention and Control Mechanism to consolidate our collaboration with other authorities and guard all the ports of our country. Thank you.
第一位穿绿色衣服的记者。
谢谢主持人。每日经济新闻宏观频道记者提问。
Thank you. With the daily economic news, we have noticed that currently the pandemic is still raging across the world. Civil aviation is an important part of our fight against the virus. So for your administration, what have you done recently to fight against COVID-19? To Mr. Kong Fanwei, please. Thank you very much for your attention attached to our work. CAAC has always followed this general policy of fight against domestic rebound and imported cases. We have also applied this principle of dynamic zeroing so that we can build up the barrier against the virus. Considering the recent situation, in order to better fight against the COVID-19, we have done the following. First of all, on a regular basis, we have applied containment measures. According to the CAAC Disease Control Guidebook, as well as the requirements from the meeting in our system, the CAAC departments have set up the closed-loop management. We have applied relevant measures. So for the domestic and international flights, the aircrafts will not be used in a mixed manner, and the regions concerning the domestic flights and international flights will not have the crossed interaction, so that we can better apply this policy against domestic rebound and imported cases. Second, we also organize the training sessions for our workers. In different scenarios of emergency outbreak, we can immediately take prompt measures. We also have the drillings. We also ask different airports to set up their nucleic acid test zones and also train these airports to build up their capacity. And third, we have this meltdown mechanism. Since 2020, in total, we have applied meltdown mechanism 312 times and suspended the flight for 768 flights. And with all those measures, we have successfully lowered the risks brought by the international flights into our country.
中央广播电视总台央视记者提问：近期呢出现了多例核酸假
CCTV
阳性的这种情况， 为什么会出现这种情
Recently,
况？
we
另
have
外，这是否意
noticed
味着我们现有的核酸检测
the false
对奥密克
positive
戎毒株的这个灵敏性有
cases
所下降呢？谢谢。
with the nucleic
好，
acid
我们
test.
请郭艳
Does it
红女
mean
士来
that the
回答
nucleic
这
acid
个。
test they are
好，
not
谢谢这位记者的提问。
swift
这个
enough
近几年
against
啊，核
the
酸检
current
测一个非
variant?
常专业性的这样的一项技术啊，
In
应该说
recent
受到了
years,
社会大众的这样一个
one
高度的关
important
注，
technology
也慢慢地
related
走
to
进
the
了呢我
nucleic
们
acid
普通人
test
的
has
身边。
received a
那
lot
么
of
对于
attention
核
from the
酸检测，应
society,
该说
and it has
它
become
呢
a
是我
part
们
of our daily life.
诊
For the
断
nucleic acid
新
test,
冠病毒感染的金标准。
it helps a lot
它
with the
的阳性
diagnosis
检出
of
时
the
间早，
COVID-19. It's like the
准
golden
确
standard.
度高，是国际公认
In
的
the shortest
成
delay,
熟
it can
的
help us
我
to
们病
detect
原
a
体的一
positive
项检
case,
测的技
and
术。
is widely
那么利用核酸
recognized
检测
technology
可以
to
呢尽早
discover
发
the
现感染
virus.
者，
With nucleic
从
acid
而呢
test,
锁定
very
感
early
染
we
的
can
范围，
discover the
为疫情的
infected
防控
cases.
工作
So
应该
finally,
说
we
起
can
到了一个前哨的这样的一个关键
lock
作用。
this whole
从
area
而
of the
呢，在我
infection.
们
It's
这
like the
个
front
通过核
guard.
酸检测，进而呢能够采取呢防控的措
With
施，
nucleic acid
来
test,
切断传播途径。
we can
对于
take
实施
follow-up
四早
measures and also
落
cut
实
off the
好
chains
外
of the
防
further
护、内
transmission.
防
It
反
can
弹
help us to
和
apply
动
the
态
four
清零
early
的方针
measures and
具有
also
呢
help us
非
to
常重要
realize
的
this
作
goal
用。
of dynamic
那
zeroing
么，据
and
专家
to
介
win the
绍，
fight against
尽管
domestic
我们
rebound
核
and
酸检
imported
测的
cases.
特异
According
性
to our
是
experts,
100%，但是呢，
sometimes
在实际的工作当中，实验室可能
with the
会
nucleic
因
acid
实
test
验过程
in the
以及操
laboratories
作造成的一些
during
污
the
染而导
process
致假
or
阳性，
due
就是刚
to
才这位记者所说的
some
假阳性，到底是
operations
什么原因造成的？
that
那
is
么我们也做了一些分析。
related to the contamination of the samples, there may be the possibility of the false positive for the false positive results. Due to the contamination, there are two sources. First of all, for the proliferation, for the residue of the proliferation during the mass testing, and we have a lot of samples to test. With the machine running 24 hours a day, so every round of proliferation, there may be the problem of the cleansing not thorough enough. And the second possibility is that from sample to sample during the testing, there may be the cross-contamination. For example, if we have a positive sample or there is the element contaminating the sample that should be negative in the first place, then there is the possibility of the false positive. And sometimes in the laboratory, the workers, the operators, they didn't abide by the due process of the testing. This may also lead to a false positive. All these scenarios will not be the proof to show all of us that the nucleic acid test has become less sensitive facing the COVID-19 virus. Still, we have to admit that nucleic acid tests, they remain a very effective manner to help us detect the infected cases in an early manner. So we urge all our workers to follow the instructions of the work, especially for the environment management inside the laboratory, especially for those highly sensitive stages of the testing process. We have to abide by the rules, for example, the cleansing work and management, sanitary requirements for the inside environment of the laboratories. If in the laboratory there is abnormal rising number of the positive results, we urge the workers working there to have an analysis of this whole process. We have to rule out the possibility of contamination coming from inside of the laboratory and contamination from the environment, especially for the operation desk and also for the other places inside the laboratory. We have to clean all those parts of the environment on a regular basis and according to the book. At the same time, we have to make sure that the shifts of our employees, of our testing agents, it's very rational. We have to guarantee that they will not work in a very tired status so that they will not make further mistakes when they are dealing with the samples. At the same time, for the organizations running the nucleic acid test and the test result analysis, we have strengthened our monitoring against them. We urge them to follow the instructions and work according to the book. If there is the violation of the regulations, then immediately they will be punished.
第一排的第3位记者。
中央广播电视总台央广记者提问：现在在这个疫情常态化防
With
控的背景下呢，
CCTV,
一些公众可能还是
the
需要
Central
乘坐
Radio,
飞机来
against this
远方
background of
那么
regular
怎么如何来
measures
保障在这个
of
飞机
fight
上
against the
成为
COVID-19,
旅
some
客
people
能够
still
安
have to
全
take the
安心
flight.
并且呢防止这个疫情
So
出现
how
蔓
can
延
we
和
make
扩
sure
散
that
那么
our
我们民航
passengers
部
can
门呢采
travel
取
in
了
a very
哪些
safe
相关的
condition?
措施
And
有
how
没
can
有一
we
些新的要
curb
求
the
和
further
新的部
spread of the
署？谢谢。
virus inside the
好，我们
aircraft
请
and
孔
in
凡伟
other
先生来回
places
答这个问
related
题。
to the trips? Do you have any new ideas and measures to Mr. Kong Fanwei? Thank you very much for this question.
仍处于高位。我国仍将持续
Currently,
面临
the pandemic
外
is
防
still
输入
raging
内防
across the
反弹的
world.
巨大压力。
Our country is still
为保障国内
facing
旅
the
客
dual
放心出
pressure
行
of fight against
民航局
domestic
近期
rebounds and
就
imported
防止疫
cases.
情经航
To
空
guarantee a
途
safe
径
trip
外溢和扩散
with
我们做了以下
aviation
工
for
作
our
一
passengers,
是全面加
we
严
have
机场
considered
区域
the
从业
current
人员
status
分类
quo
管理
and taken the following
对在
measures.
机场区域
First
范
of
围
all,
内工作的从业
inside
人
the
员
airport,
进行再梳理
we
分类
have
登记
strengthened the training
综
of
合
our
评估
workers.
划分不同风险
We
类
have
别
reclassified
执
all the
行不同
workers,
等级管控
and we have
确
also
保机场
regrouped
纯净
them.
运行
We
与
have
国际
different
出境航
levels
空
of the
器
control
机
and
组旅
regulation,
客
so we can make
行
sure
李
there's the
货
pure
物
operation of the
保障设施
aircraft.
设备有
For the
直接
crew
接触
teams,
或
for
存
the
在动线
logistic
空间
teams,
接触的
and
人员
other
列为
groups
高
of
风险人员
workers who have the
与国内
direct
运行航
contact
空
with our
器机组
passengers,
旅客
they are
行李及
classified
物
as
品
the
直
high
接接
risk
触的人员
population.
列为重点
For
管控人员
the
其他
groups
从业人员
of
为一般人
workers,
员二是全面加
they
密
can be
机场区域
classified into
从业人
general
员
group
核酸
or
检测频
the
次
key group.
要求
And
高风险人
second,
员
we
和重
have
点管控人员核
strengthened
酸
the
一日一
frequency
检
of the nucleic acid
一般
test
人员核酸
against all the
隔日一检
workers in the
检测结果的反
airport.
馈要规范及时
For the
准
key
确
population,
切
every
实发
day
挥
they will
监测预
run
警
the
的作
nucleic
用
acid test.
机场
For
区域
the
从业
other
人员
groups of
在
the
离开
people,
机场区域
workers,
返
they
回工
will
作岗
do
位之
the
前
nucleic acid
要
test
持有在规定
once
时限内
every
的
2
核酸检
days.
测阴性证明和健康绿码。
And
三是
for people
全面细化旅客
traveling
运
from
输过
home
程
to
中
the
的防疫
airport,
措
they
施
should also
加
demonstrate
强
a
旅客
negative
有
result
序
of the
层级
nucleic
引导
acid test.
重点
And
关
third,
注
during the
5个
trip,
环节
we also have
进入
to
候机
give the
楼环
guidance
节
to our
要防止
passengers
在
in
测
the
温
5
查
stages.
验健康码
First of all,
时
the
发生
entrance
人
into
员
the
的聚集
waiting
拥堵
hall, we have
值
to
机环
check
节
their
鼓励网
health
上值机
certificate,
自助值
and
机
also we
增
have to
设
avoid
人工
mass
值机柜
gathering.
台
For
提
the
高值机效
check-in,
率
we
避免旅客滞
encourage
留
people to do it
安检环
online
节
or with a
在高峰时
self-service.
段增开安检通
For
道
the security
控制
check,
待检旅客流
in the
量
peak hours,
防
we
止旅
will
客
open more
长时间
channels
停
so
留在
that there
狭
will
小的
not
通
be
道内
mass
登记环
gathering
节引导旅客
before
分批次分时段登
in
记
front of the
有
gate
效
of the
管
security
控
check.
旅客之间的
And we
距离
also give the
减
guidance
少旅
to
客
people
在
so
机舱内
that
的
they
等待
will
时间
be checked in a
下机环节
staggered
引导旅
manner.
客按
And we
座位
also
顺
have to
序
reduce the
有序
waiting
离机
hours for the
避免旅客
passengers
在
inside
机
the
上
halls.
通道区
And
长
finally,
时
in the
间站
fifth
立等
step,
待
when
和
they
近距离的接
arrived
触
at the destination,
在
we
此
also have
也
to
提醒广大
get
旅
them
客
out of the
在配合
aircraft
做好
and
登机
the
前的
airport
手部
as
消
soon
毒
as
工作
possible.
以外还要自
And
觉
for
遵
our
守乘机
passengers,
的
they
各
also
项
have to
防疫规定
collaborate by
全程
disinfecting
规
their
范佩戴
hands
口罩
before the
飞
boarding.
机上
And
要
throughout
减
the
少
whole
不必要
process,
走动
all the
非
passengers
特
should
殊情
abide
况
by the
禁
rules
止更
of the
换
mask
调换座位
wearing, and
避
also
免因
they
个人
have
防
to
护到
avoid
位造
unnecessary
成暴露
walking
风险
inside the
谢谢
cabins.
好，谢谢。请
They
继
also
续提
should
问。
not change the
好，来，请
seats
这次
in an
去
arbitrary
第一排
manner.
考过到第一位记者。
Next question, please.
您好，谢谢主持人。当前境外疫情持续高位
Good afternoon, thank you.
我们国家的外防输入
Currently,
压力持续
the
加大
virus still raging across the world, and we are facing rising tensions. For the containment measures at the ports, what can we do to better safeguard our country? To Mr. Liu Haitao, thank you very much for this question. Since the outbreak of the pandemic, our administration of immigration has worked very hard to fight against domestic rebound and imported cases. We have applied the dynamic zeroing policy, and we have made a lot of containment measures. Considering the current situation, we have raced against the clock to apply all the following measures. First of all, for the aviation ports, we have the classification and regrouping for the checks. For international airports, we have this reclassification according to the levels of the risks. So the measures in place, they are more targeted. We make sure that we separate the people, the flows of the passengers from international flights and domestic flights. We also separate passengers from the crew members, separate the goods from the people, and separate the people in transfer from the people in arrivals and in departure. We also work with the destination airports to have this transfer of suspicious cases in a closed loop. Second, for the water transportation, we have made full use of our online service platform and service windows to enable the preliminary checks of the international ships online. We also have the non-contact inspections. There is also the code that will help the workers working at the port to better accomplish their work of the checks. For the verification of the results of the nucleic acid test and also the vaccination status, there's the auto check. So for ships coming from foreign countries and the domestic ones, they are managed in different zones and in different procedures. So we have separated the ships too. There's fewer possibility for them to get cross-contaminated. And next, on the continent, by the ports and by the borders, for the vehicles, we have fixated their routine, their trajectory of the transportation. We also have measures to separate people from the vehicles. For private vehicles, we also have this examination process of the status. We have places to run the nucleic acid test so that there will be fewer risk of the spreading of the virus through the goods and the vehicles. And fourth, we have this collaborated mechanism of containment of the virus. Party members have played an important role, especially at the borders. We have the physical barriers built up by the border area. We also have the risk management and control measures. We collaborate with our neighboring countries. Authorities of the immigration and customs have worked together. We have also intensified the patrolling at the border. We will make sure that there's no imported virus through the unlawful entry into the country. For the violators of the law who have traveled across the border against the regulations, we will immediately crack them down. Thank you.
谢谢主持人，新京报提问。近期国家卫健委也是提出要
Thank
提
you.
前规划
With the
准备避免医
Xinjiang
院和
Journal,
方舱医院。
Currently, according to NHC, we have to prepare the designated hospitals and makeshift hospitals in advance. Why this difference and distinction? And what's the expectation for the size of the two types of hospitals? The preparation of makeshift hospitals, does it mean that the situation has become worse? And what's the definition of the so-called permanent makeshift hospital? To Madam Guo Yanhong, thank you very much for this question. First of all, the construction of the makeshift hospitals is not the sign to say that the situation has become worse. Actually, it corresponds with the characteristics of the Omicron variant. Because we really would like to be fully prepared before the outbreak of the emergency, and we would like to be very quick. You know that the infectious virus of the Omicron variant usually can be spread in a very hidden way and in a fast way. And in general, infected cases, they are mild cases, and sometimes they are asymptomatic cases. In a very short period of time, there would be a spike in the number of those newly infected cases. So immediately after the discovery, we would like to take all of them into the hospital so we can cut off the chain of further spreading of the virus, and we can also thus prevent further infection among the population. So makeshift hospital would be a very effective measure, because if we have the makeshift hospitals, we can immediately treat those infected cases. At the same time, we have to handle the relations between a conventional hospital and a makeshift hospital. We have to be very proactive in the construction of the makeshift hospitals. At the same time, we have to apply the tiered treatment system. Considering the characteristics of the Omicron variant, for the classification of the patients, because the majority of the cases, they are mild cases, and also there are some asymptomatic ones, we will put them into the makeshift hospitals. There, they will be put into the medical observation and quarantine. By doing that, we can avoid further spreading of the virus. For the general cases, severe cases and critical cases, we will put them into the hospitals, the designated hospitals that have a higher capacity of the treatment, so we can lower the ratio of mortality and increase the ratio of full cure. For all locales, they have to follow the principle and transform a certain number of the infrastructures to make sure that once there is a sudden outbreak, then within 24 hours, those designated infrastructures would be transformed into temporary makeshift hospitals. We also have the tiered treatment mechanism for different types of cases. For mild cases and asymptomatic cases, they will be put into the makeshift hospitals. For the patients with the risk factors, like the general cases, critical and severe cases, they will be treated in the designated hospitals. Like that, we are running this tiered treatment. At the same time, with a new version of treatment and diagnosis, which is based on our good practices, results of the research, and our experience. After the treatment of the cases, if the CT value of the nucleic acid test is above 35, then they can be discharged. This means that we can immediately give that part of the medical resource to the next person, so there will not be the squeezing of the hospital resources. By doing that, we can guarantee the necessary treatment to the cases, and also we can guarantee the normal operation of the hospitals for the other departments to work normally. For the preparation of the makeshift hospital, it's very meaningful work. And speaking of the makeshift hospitals, they are relying on existing infrastructure. First of all, we will change or modify the deployment. For example, the network of the water supply, for the electricity, for the corridors, and also for the other facilities of the ventilation, for the toilets and baths. We have to make sure that these infrastructures have all those basic conditions. At the same time, we have to prepare the other resources like the medical equipment, materials, we also have to set up this
关键的。
information technology system. The ID system would have a very big role to play during the treatment. Once there is the sudden outbreak, with all those resources prepared in advance, immediately we can assemble all of them together and put up this makeshift hospital. Makeshift hospitals, they work very well against COVID-19, but not only so. They are also a very important way to treat the patients when there is other kinds of pandemic or infectious diseases or a major outbreak of the public safety incidents. So for those infrastructures, in a normal situation, we will keep their original function, but when there is a sudden outbreak of the virus, we will immediately turn them into the makeshift hospital, and like that, we can over the night create a lot more available beds. So we should make sure that there's always a bigger number of the beds waiting for the patients to arrive, and we should not make our patients wait for the treatment bed. On the one hand, we have to make sure there is the sufficient treatment resources for the COVID-19 patients, and on the other hand, we also have to make sure that there are also available services for the other kinds of patients.
谢谢。我想问一下移民局，因为最近网上有传言，有中国公民的出入境证
Thank
件
you.
被无
Question
故
for the
检检
National
然后5月
Immigration
13日的时候，国家移民管理局也做了澄
Administration.
清，能否再解释一下
There's
当前的
word
证件管理的具体
saying
政策？
that
另外，
some
据我了解，确实
people
对部分
have
的出入境
mentioned
证
on
件
the
会
web
做出
that
减缴
their
措施。那请您解释一下，什么情况下才会减缴？
passport
谢谢。
or their other
好，
documents
我
have
们请
been
刘海涛先生来回答这个问题。
taken or
感谢您对移民管理工作的关注。
retained by the administration. Could you please give us more
网上
explanation?
有关停办护照，减缴外国这个居留证件，包括绿卡，
Word said on
这个
the
传言的
internet
均系
that
虚
there
假的
is
消
the
息。
capture of the passport or the
比
suspension
如网
of
上传
the
在上
application
海的
of
虹桥
passport.
机场
Those are fake
出境
news.
赴法国
For example,
被收走护
someone
照
said that
和法
in
国的居留卡。
Shanghai from the Hongqiao International
我现在
Airport,
可以告诉你
a，person
事实上，
that
上
has
海
a
虹桥
plan
机场
to
自
visit
2020
France
年的3月
has
20
his
号起
passport captured by the
就
customs.
停飞
Actually,
了
that
包括
is
飞
a
往
fake
法国
news
的所有国际航班。
because we have already
所以相关的传
suspended
言的时
the
间、
flight from that
地
airport
点、
to France.
事由，完全都是捏造。
Considering the date
再比如，
and also the site mentioned in that piece of news, if you verify, you can see that
根据道
it's
听
made
途说
up.
编造
And
他人
another
从北京
news, one
入
citizen
境护照无端被骗
in Guangzhou has made up the news
通过网
saying
络平台
that
进行发布。
someone's passport has been
再比如，
destroyed
网传
when
从广州
he's
出国
entering the
绿卡
customs
被
in
检
Beijing. That is also a piece of fake
事
news.
实上，
And also the green
移民
card
管理机构
captured
从未对包括
and
绿卡
destroyed by the customs.
外国
That is
的
also a
签
piece
发
of
的
fake news.
居停留证件进行检缴。
For those documents for the
上述的
stay
传言完全没
or
有事实依
residence
据。相关的
delivered
责
by
任
a foreign
者被
authority,
公安
we
机
have
关
never seized
依法
any
处理。
document of that.
那么借此机
All
会啊
those are
刚才
fake
你也
news, and
提到
people
这个我也
spreading
想
the
告
fake
诉大家
news or people
按照
creating
相关
those
的
rumors, they
法
have
律规
already
范
been seized by the Administration of Public Security.
移民管理
According
机
to
构
the laws and regulations,
在一申请
National
审核
Immigration
签发当事人
Administration,
的出入证件的时
upon
候
the application of
出入
the
境边
people,
检机关在检查当中发
will
现
do
当
the
事人所
verification
持
and
的中国
approval
出
of
入
the
境证件
document.
已被
During
依
the
法宣
inspection,
布作废的时候，会对已失
if
效的
people
证
are
件
using invalid
做检缴处理
documents,
以
then
防
we
呢
will
被不
capture
法
that
分子利用
invalid document. because we don't want those invalid documents to fall into the hands of the wrongdoers. And by doing that, we are actually protecting the rights and interests of the holder of the certificate. And that practice is not unique in China. It's a common practice in a lot more countries across the world. In the past, we have signed the documents for the entry and exit of the country according to the law. We have standardized the law enforcement procedure in order to better protect the rights and interests of the people visiting our country. And we always played a role to facilitate the opening up of our country and the exchanges of the people. We will continue to take effective measures to better serve the people entering and leaving the country. You're all welcome to monitor our work. Thank you.
好，来请右侧区第2排第2位穿灰色衣服的记者。
谢谢主持人。中国国门时报记者提问。当前外防输入压力进一步加大，新冠肺炎疫情
Currently, we are under huge pressure of fight against imported cases, especially the risk correlated with the imported goods in the cold chain. How can we make sure that there is no virus hidden within the imported cold food? To Mr. Li Zhengliang. Thank you very much for this question. In order to fight against the spreading of the virus through the imported cold goods, the customs has worked under the requirements of the State Council and have applied strict measures. On the one hand, we have strengthened the control of the origin and the source. For the exporters, we have communicated with them. For those enterprises, we urge them to assume their responsibilities for the package of the goods and even during the process of the production, processing, and also the transportation. We make sure that there is no risk of contamination of the food by the virus. For the overseas enterprises, we also do the random inspection through the video. We have already checked 519 enterprises doing business in a cold chain. We have also organized 717 sessions of conferences with other authorities. And other foreign countries have immediately abolished the right of more than 800 enterprises to export their goods towards China. Last week, for 170 enterprises that have already registered the clusters of infected cases, we have suspended their exportation of the goods. A lot of them have voluntarily abandoned their exportation. Over the past period, according to the results of the nucleic acid test, for the key regions, we have strengthened the proportion and number of sampling from their exported goods. We have in total taken 4.87 million samples, among which we have discovered 1,384 samples of positive results. For the related enterprises, we will suspend their application for the exportation into China for 1 to 4 weeks. As of last week, for 567 enterprises, we have taken many measures of inspection and control. We have continued with the disinfection measures according to the work plan of the Joint Prevention and Control Mechanism of the State Council. For the imported cold goods, at the port, we do preliminary disinfection. As of last week, at the ports on the front line, we have in total disinfected the packages.
5是严格实施封闭管理，对海关系统所有进口冷链食品
of more than 117 million. At the same time, we also take the temperatures of the workers. We make sure that we have the control of the risk exposure of those workers.
谢谢主持人。红星新闻记者提问，请问我国新冠疫苗
Thank you. With the Red Star News.
接种进展如何？尤其是60岁以上的老年人。
What's the progress with the vaccination, especially for the elderly population above 60 years old? To Mr. Lei Zhenglong, please. Thank you very much for your question. According to the work arrangement of the Joint Prevention and Control Mechanism of the State Council, we are progressing with the vaccination. As of 22nd of May, in total, we have vaccinated more than 3.3 billion doses to cover 1.28 billion people. 1.25 billion people are fully vaccinated. For the people covered and people fully vaccinated, they represent 91.4% and 88% respectively of the total national population. For people above 60 years old, we have covered more than 200 million of them. Fully vaccinated, more than 200 million. For the proportion of fully covered and vaccinated people, they represent 86 and 82% respectively of the age group. There are also a huge portion of the elderly population boosted. We are progressing very well with the vaccination. Of course, we are now facing a huge task in our fight against the COVID-19. Vaccines would be a great help for us to fight against COVID. And now we are urging the localities to continue with the vaccination to better educate the people to proceed with the vaccination for the elderly population. For all the people that should be vaccinated, we should make sure that they can have the opportunity. The last two questions of today. Thank you. With Oriental News, in Shanghai, Hangzhou, and Shenzhen, they are establishing the 15 minutes walk of the sampling for nucleic acid test. In Shanghai, more than 9,000 spots of the sampling, and in Hangzhou, more than 10,000 spots of nucleic acid test. Is it too costly to set up those sampling spots? Is it a necessary move? And I also would like to ask whether those fast circles of the nucleic acid test, they are only available in the large cities with a population of more than 10 million. Is it accessible in the secondary and third level cities? To Madam Guo Yanhong, please. Omicron variants, they can be spreading in a very hidden manner. In the early stage, we have already registered several outbreaks in different cities. When discovered, they are already spread at the community level for a certain period of time. And that means we were already a little bit late, and we are facing a huge task. In the high-risk regions and cities, the permanent or regular mechanism of nucleic acid test would help us to increase our capacity in face of the virus, because we can put in place a network of monitoring and discovery. By doing that, we are fulfilling our requirements of the 4 earlies. And we test all the people that should be tested or people who would like to be tested. We give more convenience to the people to have the fast track to the nucleic acid test. As is mentioned by our journalist, in several cities and regions of our country, we have explored the establishment of the permanent testing sites, like in Hangzhou, Shanghai. They have already set up the deployment work for the fast testing. for Shenzhen, Dalian, and Hefei, and in Jiangxi province and Hubei province, many cities there have also started their planification. In all those places, they have first of all evaluated their current conditions. The purpose is to shorten the waiting period for the residents to have the nuclear test, and they can also save the other necessary medical resources at the hospital site if they have this permanent testing sites by the community level. And a lot of fruitful results have been yielded. With the united purchasing of the materials for doing the test, we are also lowering the cost of the nucleic acid test. It can also help to guarantee an orderly proceeding of the daily containment measures. If we put the focus on prevention, actually we are saving a lot of cost. If we can stop the spreading of the virus at the prevention stage, then we can best protect the life and also the treasure of our people and our population. We can also make sure our country can continue to operate in a very steady situation. Some departments of the State Council, they are also doing the researches to further lower the cost of nucleic acid tests. A permanent mechanism of nucleic acid tests should be decided and dependent on the local situations. It's not one measure for all places. So we don't oblige all the places to set up a 15-minute walk of circle for the nucleic acid test. Now we only require those big cities with a population of more than 10 million and the large cities to do this work, and we don't ask every city in the country to urge their residents to run nucleic acid test every 48 hours. We have to make decisions based on the real-time development of the situation. So the decision-making should be made on a science-based manner. It's also true in the nucleic acid test. Last question for today. Thank you. With the Hong Kong Business Journal, currently cross-border commerce is also developing very fast. How can you make sure you can facilitate the normal operation at the ports? To Mr. Liu Haitao, thank you very much for this question. After the outbreak, for the National Immigration Administration, we have worked very efficiently on the efficient basis. We would like to coordinate the fight against the COVID-19 and the boost of socioeconomic development, while ensuring the containment measures applied in place. We also would like to guarantee the normal circulation and flow of people and goods across the borders. We have taken a lot of measures to guarantee the customs clearance and declaration, as well as the safe circulation of the people. We have already made 3 channels possible. First of all, for the key flights, for the goods, we have this obstacle-free channel. In a major port of aviation, we have designated zones in Shanghai, in Beijing, Guangzhou, as well as the other hubs of transportation within 24 hours. And within the designated zone, the crews don't have to go through all the procedures. That is a very convenient track for the goods that cannot wait too long. Then we also streamline the process of the registration and inspection. For the international aircraft, we also make sure that they have this quick departure. Second, we also have the fast track for the vehicles. For the road transportation, we will increase the efficiency of the checks. For drivers with Chinese nationalities, after the registration, they don't need to fill in the check certificate. For the drivers traveling from mainland to the SARs, we give them the fast track services. For the trucks delivering daily necessities, fresh goods, and important goods to facilitate the farming and fight against the COVID-19, we also give them fast track services. And third, there's also the obstacle-free track for the offshore ships. They will not go near the ports. On that basis, we work with the other authorities to set up this mechanism of the changes of shifts among the sailors. For the key employees on the ship, we make sure the replacement is operated in an orderly manner and everything is going on smoothly. Thank you very much, Mr. Liu Haitao, and thank you for all of our speakers. Our press conference will continue in the future. Thank you very much for your attention. That's all for today. Thank you.